what sets us apart is that we have the experience of private practice cosmetic surgery, particularly as it relates to breast and body, that gets to blend with academic expertise and dealing with procedures that come to a tertiary surgery center on a regular basis, which is typically the most challenging of cases that there are, and really getting to combine and bring that kind of expertise and this kind of expertise into a community where patients can have care that is, I would argue, second to none, and still be at home. And that definitely sets us apart from anywhere else, I would argue, in the region, really.
When you go to have a surgery, to have the feeling of full 100% confidence that when you wake up, you know you're gonna have what you want, is a good feeling. And every surgery I've had wasn't even a question. But when I woke up, I knew that what we talked about and what I needed to look like, I was gonna look like. And he came through every time.
What we built together was to bring those complex procedures to Lafayette. And you know what sets us apart is that we offer, if we're talking about restorative breast surgery, we offer the whole spectrum of restorative procedure, from the more traditional implant-based approach to the most complicated microsurgical reconstruction, what we like to refer to as patient-specific microsurgical reconstruction.
Dr. Delatte came highly, highly recommended. I didn't want to do treatment. So we called and made an appointment, and Dr. Delatte got us in that same day. And from the time I walked into his office, I felt like that's where God wanted me. He was always very patient. He always explained everything to me. He was just fantastic. He was awesome. So worth it, so worth it. If I had to do it again today, I would do it again today. And I would want Dr. Delatte to do it.
The reason I think I've been able to develop that experience in that field is the ability to develop good relationship, not only with patients, but also with other physicians. I've always been involved in group, in team approach. Even from the time I was a craniofacial surgeon, this is all team-based, same way the treatment of breast cancer is. You know, you need a good relationship with the breast surgeon and the entire member of the team. And certainly the surgeries that we do always require 2 plastic surgeons. So you need somebody who's able to get along with people and able to deliver what's required.
I tell Dr. Lott when I go see him, my life has been enhanced. I no longer deal with the pain that the cysts were there. I never, ever worry about breast cancer. I'm very grateful to the whole staff. Having
been in practice now for 16 years, I guess, I like to explain to patients that having experience in taking care of not only primary augmentations, but having had the privilege now of taking care of patients who've had maybe multiple other cosmetic operations, gives you a unique perspective on how to take care of essentially anything that might come up with their breast. I think having good judgment, having lots of experience are important in helping patients to hopefully get to that point of being pleased with their result in as fewer procedures as they can, and hopefully have that last as long as possible for them. So I think that's one of the things that makes an experienced surgeon uniquely qualified